If you're a new parent, wow, you have so much on your plate. So today we're going to zero in on one thing that's super important but can sometimes get missed in the chaos: preventing baby bottle tooth decay.
So, let me ask you, does this phrase ring a bell at all? Nursing bottle syndrome? Maybe you've heard it from your parents or read it somewhere online.
It's actually a pretty serious thing. And while the name is a little old-fashioned, the condition itself is definitely still around. It just goes by a different name these days. What we call it now is early childhood caries, or ECC for short. This is the official clinical term for tooth decay in little ones. We're talking infants and toddlers. It's the exact same problem as nursing bottle syndrome, just with a more up-to-date name.
You know, it's funny, this thing has collected a bunch of nicknames over the years. Nursing caries, bottle mouth syndrome, you name it. And really, the fact that there are so many names for it just goes to show you how common this problem is. But they all point to the very same issue.
So where does this nasty decay usually pop up? Well, the number one spot is the upper front teeth. And it makes sense when you think about it, right? When a baby dozes off with a bottle, the milk or juice just pools right there, basically soaking those little teeth in sugar for hours on end.
And this quote just hits the nail on the head. It's rampant decay that results from sleeping with a feeding bottle. It's that simple and that direct. It really zeroes in on the main culprit here.
Okay, so that naturally leads us to the big question. The one every parent is asking: what can I do about it? How do I stop this from ever happening? And the good news is, the steps are totally clear and absolutely manageable.
Here it is, your 4-part prevention plan. We're going to talk about supplementing their diet, switching to a cut for sugary drinks, starting their oral hygiene routine way earlier than you think, and of course, scheduling that very first dental visit. Let's dive in.
All right, first up, food. Sometime between 4 and 6 months old, you'll want to start bringing non-liquid foods into the mix. This is a huge step in helping them rely less on the bottle, especially as a comfort object. Step 2, and listen, this one is a game changer. For any drink that has sugar in it, and that includes milk and juice, serve it in a cup, not a bottle. This helps break that really dangerous habit of letting them sip on something sweet for a long time, especially around nap time. Okay, step 3 is all about getting a head start. Oral care does not begin when they have a full mouth of teeth. Nope, it starts the second that very first tooth pushes through. In fact, you can even start before that just by gently wiping their gums with a clean, damp cloth after feedings. And finally, step 4, get that first dental appointment on the calendar. The rule of thumb is to see a dentist within 6 months of that first tooth making its appearance. This is so important. It gets them comfortable with the dentist and gives you access to expert advice right from the get-go.
So let's just lay it all out in a simple timeline. Around 4 to 6 months, you're introducing solids. The moment you spot that first tooth, you're starting oral hygiene. And then, within 6 months of that big day, you're booking their first dental visit. That's it. That's your roadmap to a healthy little smile.
So look, the big takeaway here is that preventing this is not complicated, but you do have to be on top of it. Your child's oral health journey literally starts on day 1. So the only question is, are you ready?